women through this difficult and delicate issue. We spoke to Dr. Michael Krychman at Hoag Memorial Hospital Presbyterian in Newport Beach about this issue.
I am the medical director of sexual medicine at Hoag Hospital, and we have an innovative, interesting program where we evaluate and treat women who have intimacy or sexual health concerns. This changes throughout their whole life cycle depending on their complaints. We do a comprehensive medical approach, try and get the underlying medical conditions that might be impacting their relationships or their intimacy concerns. We evaluate, we treat, and we also want to involve other healthcare providers, which include, if needed, therapy as well. We like to include all women of all backgrounds, ages, and all concerns and have those issues treated. One of two concerns would be changes in desire in terms of a relationship. You have the married woman who is in a good relationship with her husband, and her interest in sexual intimacy has changed over time. And this could be for a multitude of different reasons. The other big concern that we do see and evaluate and treat at the center would be sexual pain problems relating to sometimes menopausal changes, whether it's as a result of period stopping and lowered estrogen levels, whether it's a result of chronic disease. Both the medical, psychological, environmental issues are also assessed and treated as well. And about 50% of all women are having some form of sexual complaint at one point or another during their life cycle. And again, as relationships change and as your life changes and you experience different things, intimacy is impacted. One of the common things that we do see is very good relationships that are really suffering from sexual boredom. So we also work on that facet as well. We also have a wide variety of consult people that are available to us in terms of resources. We have an active physical therapy department. We liaison with healthcare providers in the community to evaluate pain management, to involve internal medicine should chronic medical diseases be a concern. So we work with people who specialize in diabetes and heart disease as well. We have a very strong relationship with people who are specialized and certified to do sex therapy, should that be an important part of the therapeutic process. Sexual medicine has a very high success rate, and I think that when you have an approach like we do at the center, where we encourage women to make appointments and bring their partners, I think that our success rate is extraordinarily high. The biggest charge of this center is to have it accessible. It's a huge issue that is unaddressed, and we want to make it as accessible as possible. We do take self-referral, and we take referrals from their primary care physicians as well.